The Association of Rural Surgeons of India is a group of dedicated surgeons working in rural and remote areas of our country. The Rural Surgery Innovations is a project of ARSI and the International Federation of Rural Surgeons, whose objective is to take the modern surgical technology to the poor and the marginalized in rural areas. And how do they do it? One of the ways they started doing it is by sharing equipment and human resource so that these modern surgeries are made available and affordable to the rural population. And then they need to innovate to make these available. For example, less than half the operating rooms in rural areas have facilities for general anesthesia. And even if they do have, getting gases for anesthesia and surgery is a big problem there. So we innovated the gasless laparoscopic surgeries, which makes laparoscopic surgery possible under spinal anesthesia, which is available even in very remote areas of our country. And then we found that only 2% of the population are able to afford urology treatment, especially in rural areas. Hence, we developed the laptop cystoscope, which makes urology surgeries possible with a 1/20th of the investment which is necessary for the conventional cystoscopy. How did we make this possible? The technology we used is called a frugal innovation, which includes participatory design. The aim of the technology is to make it as simple as possible. For example, with the gasless laparoscopic surgeries, earlier it was the gas which made the abdomen distend to make surgeries possible. Here, a mechanical elevator is used to make the surgeries possible. As far as the laptop cystoscope is concerned, earlier there was a telescope which connected to a camera, which then connected to a big monitor. And then we needed light source and a lot of complicated equipment was involved. What we did was put the endoscopic camera at the tip of the scope so that it directly connects to the laptop cystoscope. What are the impact of such innovations? In the areas where we are working, it increased the number of surgeries carried out almost fourfold. And many rural patients, almost 2,000 patients, were able to get these minimally invasive treatment at an affordable cost in these rural areas. And we're almost close to making the Lancet recommendation of surgical coverage for 100,000 population. And these innovations were the ones which made that possible. Thank you.